Hi, and welcome to Mind Your Health. Dr. David Burke.
Good morning.
Great to see you. We have a wonderful guest to introduce you today.
We have well over 50 employed primary care
Oh, wow, I didn't know that. Okay.
in our multi-specialty physician group. They are focused on prevention and wellness, and we are standing up certain new plans such as patient-centered medical home models and accountable care organizations. And all of these organizations and models we're setting up are designed to keep people out of the hospital.
Mind your health.
You got to mind your health.
Mind your health.
Treat yourself. You got to mind your health.
Russell Baxley, thank you so much for joining us. You are President and CEO of Beaufort Memorial Health System.
Yes, yes.
And I'm really excited because I've been here for well, you too, you and I have been here for many years. And we've watched Beaufort Memorial really go from a tiny local hospital into this incredible healthcare system. And with that, and with healthcare as a whole, we got lots and lots of fun questions to ask and to get your input on. And I think to begin at the beginning, can we talk a little bit about you, where you grew up, and kind of morphing into being the president and CEO? What does that really look like?
Sure. Well, first, thank you guys, Debbie, David, for having me on. I'm excited to be here. And, I am born and raised in South Carolina. So I started on a small farm in Johnsonville, South Carolina, and grew up on that farm, which is really when a lot of people ask me, where did you develop your work ethic? It's growing up on a tobacco and hog farm.
I believe that.
Yes. And but when I turned 18 and graduated from little old Johnsonville High School, I informed the family that I would not be back, and that farming was not
Right.
what I ultimately wanted to do with the rest of my life. And went to Clemson University, graduated from there in 4 years, then went to University of South Carolina, Columbia, to get my
Look
master's in
at you,
healthcare
covered all the
administration.
territory.
So I could technically pull for both schools, but if you look at my office, there's only one color in that office, and it's orange.
I do remember that
yes.
from your office. Yeah.
Absolutely. And from there, my healthcare career took me to several locations. First, starting in practice management. I actually ran a small family practice in Columbia, South Carolina, while I was in grad school. And from there, went to Texas and was an ACFO and practice administrator for a hospital and health system there in Paris, Texas.
Got it.
Which their claim to fame is they have the third largest Eiffel Tower in the world. First is
Everything's bigger
Paris,
in Texas.
France, obviously. The second is Las Vegas, and the third
didn't
is
know
Paris,
that.
Texas.
Well, that is a fun fact.
There is a fun, and they have a red cowboy hat, which makes them the third tallest
That's so cool.
Eiffel Tower in the world. Then I went to Hartsville, South Carolina, up to Lancaster, Pennsylvania, where I was the CEO up there at a hospital system right outside of Philadelphia. And then I've been here in Beaufort for 10 years now.
What is it about being president and CEO and being in hospital administration that was so encouraging for you, or you felt passionate about, or something that you really felt like you had a calling for?
Well, to be honest, when I went to Clemson, it was an undergraduate degree in microbiology because it was believed that I was going to be a physician.
Okay.
And I just took the other route.
Oh, you're a smart man.
And well, and I have my mother to thank for this. My mother was a controller at Lake City Community Hospital in Lake City, South Carolina.
Okay.
And when I decided not to go to medical school, I wasn't sure what I wanted to do. It wasn't going to be in the lab as a microbiologist.
Right.
So I ended up going to graduate school at her advice, because she said, well, if you don't want to be in science anymore, why don't you go to graduate school and get your healthcare administration degree?
Yeah. Manage the scientists.
Yeah.
And so I'm not sure at first it was a calling as much it was a what do I do now
Right.
sort of moment, but it ended up being really the best advice I've ever gotten because it did turn into a calling, and more so on the people and leadership side, and really helping to grow and develop the system and people was really my passion in terms of why I really like what I do.
So as a psychologist, I'm really all about culture.
Yes.
And so when I hear hospital system, I hear Beaufort Memorial in your background, I think maybe my question should be, talk to me about the culture of the institution that you lead and how you do that specifically.
Well, we have a new CNO at our hospital, Marisa Jamerica, and she's coming from Roper St. Francis. And, she put it very nicely in her very first department head meeting when she addressed the department directors as sort of her introduction. She said, I immediately understand the culture here, which is community and family first.
Okay.
And that is really the culture of Beaufort Memorial, is that we are a community hospital serving our community, and people are really passionate about that. Most hospitals and health systems these days are part of a large corporate system that is not based in the communities they serve. We're one of the rare few that is still a standalone community hospital. And so, the leadership, medical staff, everyone that works at this facility, at our multiple facilities, they live in the community, they work in the community, they go to church and the grocery stores in the community. And so we own that in a unique and special way
Got
that you
it.
don't find in a lot of hospitals and health systems these days.
What is the difference between a hospital, because that's how I grew up with a hospital, and a hospital system? Because now I know I'm in Hilton Head, I see Beaufort Memorial here. So is that part of the system? It's just little,
It is. Healthcare has evolved rapidly, especially in the last 10 to 20 years. But,
okay,
a hospital, as we used to know it, is a standalone facility
right.
with four walls that did
Hmm.
mostly inpatient admissions and discharges and complicated surgical procedures, and had an emergency room to serve in that 24/7 capacity. And now hospitals have evolved into systems in which they're still focused on the inpatient aspect of healthcare, but very much now focused on the outpatients and the network of physician practices and ambulatory surgery centers and imaging centers and medical office buildings, really designed to meet people where they are. Instead of people having to travel long distances to get to a hospital, now they're traveling much shorter distances to more outpatient design facilities, which is really where healthcare has evolved. There's more and more that is done on an outpatient same day basis than there is on an inpatient. I'm going to stay in the hospital 3, 4, 5 days on end. Healthcare has evolved because of AI, robotics, advanced diagnostics. I mean,
Yes.
everything has moved us more to same day services.
So what are you doing behind the scenes as nurses are nursing, and physicians are doctoring, pharmacists are treating, with
Dispensing.
medicines, dispensing? You're this leader, sort of enigmatic person. What is your role to help coordinate all that?
That's a good question.
Right.
So what does a CEO do all day,
Yeah, well,
essentially?
that was really what I was at. What do you do all
What
day?
do I do all day? Sometimes I'm sure many wonder that. I see my role as making everyone else's jobs easier,
Okay.
right? I mean, my role is to facilitate high quality health care and to allow those that are trained to treat the patients to do their job well and effectively. And healthcare is complex, and it's mostly complex based on the complicated payer system
Okay, that's what we were just
in,
talking about.
in
Okay.
which we have to navigate, that we struggle with at times.
I can already feel the heartburn.
All right.
Yes.
Is that the complicated payment system, that is insurances and who does
Insurance,
what?
managed care,
Okay.
even to the extent of drug
Medicare.
manufacturers
Okay.
and 340B programs and governmental programs that really affect how we operate hospitals day to day, as well as dealing with the issues that every employer deals with: the lack of staffing, the high cost of doing business,
Yes.
hyperinflation that we've experienced, managing all that while not letting it affect the high quality care that is delivered. That is really the complexities in which I work, in hopes that the physicians, the nurses, the therapists, the pharmacists, the allied health personnel that are really doing the great work for the community, let them focus on healthcare and let us focus on making sure that the business stays solvent.
So
moving forward.
going back to the culture of all that.
Yeah, so I mean, just tag along with that, the difficulty of people don't understand is I want to provide the top level, best healthcare I can possibly provide. The insurance company wants to give me $10 for that.
Right.
And to find that balance. And then when I do everything right and I do get paid for it, well, then the legal profession wants to get involved and question everything. Healthcare is a mess.
And so you have to even wait for the payments half the time because everything
Oh,
has to be
absolutely.
approved.
Correct.
And
You're back billing and yes.
And the payers have gotten more adept at delaying those payments, and whether it be requesting for more medical records once the procedure is done, or denying upfront or underpaying, paying on, you may submit multiple codes on one claim and they may pay two, but not pay the other three. And you have to go back and catch that and ask for those three to be paid. And so it
Interesting.
really is not only delay tactics, but even to the extent that as patients are seeing their deductibles increase, and that delays payments to hospitals because most patients are seeing a $5,000 or $10,000 out of pocket, and most patients don't have
Have
five or
it, right.
10,000. And so payers are waiting longer to pay because that first dollar coverage is being shifted more to the patients up front. And that means insurance companies pay much later in the claims life cycle, if you will, of as patients utilize those resources.
So going back to that trauma-informed care, how do I treat my patient population like I'm treating the employees so that everyone feels like I'm being looked at as a person and not an object? And who advocates? Do you have patient advocates?
We do. We have several patient advocates. We have volunteers that work at the hospital that are also patient advocates.
Mhm.
We have a whole team that is focused on quality, safety, and patient satisfaction. I mean, that's what they focus on every day.
Well, and I can just say this because I'm a psychologist and you guys have a wonderful behavioral health area.
We do.
And most of the time when my folks come in, I'm either with them or and it can be really intimidating and scary. But always have people walked us through and been with us through the whole process. And that sort of alleviates some of that
Sure.
fear. But I imagine folks who come to the hospital are pretty scared.
Absolutely. I mean, we
Forget
always
the financial piece.
Sure.
I know you guys are like, go on the
Yeah,
finances.
some
I'm
get
like,
scared when the
let's
bill
do
shows up.
emotional. Yeah.
Well, the anxiousness, right? Because I
Yeah.
mean, most people don't understand what is happening, and so
Right.
the first thing we focus on, the first thing we focus on is obviously why you're here from a health perspective, but you also, to your point, have to focus on the mental health aspect of it, and it's not just the patient; it's the family members
Sure.
as well, right?
Yeah.
Because they are as anxious, and so we look at every patient and their family members as a team.
Yes.
And that team is who we work with to provide that high quality care and hopefully get you home well and healthy and discharged from the hospital as quickly as possible.
And that's called that communication. I think people are really patient as long as they know something, right? And every time I've been there, just the communication has been really good. Even if it's been, you're going to have to sit here for 45 minutes or 2 hours, doesn't
Yes.
matter. You talked to me.
People want to know.
Yeah, you
Yeah,
treated me like
they
a
want to
human
understand what is
being.
And I
happening.
think that has significantly changed in those 10 and 20 years that you're talking about because, we're both old enough to know it was, my way or the highway. You
That's
didn't
right.
question the doctor. He didn't tell you anything. He wouldn't even tell you what was the matter with maybe yourself or one of your family members. It was kind of hush hush. Where now it's much more communicative of what's going on and what do people anticipate. And you're right, it's taken the scariness out of
It
it.
really has.
Absolutely.
From a services point of view, my assumption is you can't be all things to all people everywhere all the time. How does Beaufort Memorial, how does your entity pick and choose what services our community needs? I mean, I look around at the demographics. Are we really all 72-year-olds or are we like you with little people running around?
Not all of us are 72.
No, not all of us are 72. Look at Gustavo's like me either.
It's a really good question. I mean, I think the first thing that we always discuss when looking at service line planning and strategic planning is making sure we don't get over the tip of our skis, if you will,
Okay.
and making sure we have good partners with the academic health systems that surround us for certain tertiary care services that really ought to be performed in an academic tertiary level setting. And, a good example of that is neurosurgery. Everyone asks, when we going
Oh,
to start a neurosurgical program? And I've had neurosurgical programs before, but yeah, there has to be a certain minimum population and
sure.
certain demographic to support such a program because what you always want to understand is, all right, when a neurosurgeon or let's say cardiothoracic surgeon
Sure.
tells the community, how many procedures are they going to be able to do? And based on those procedures, not only how many can they do, but how many can the staff do? Because just like anything else, practice makes perfect.
Sure.
And so what we look at is the demographics, the service line development, admissions, what is leaving the marketplace. And honestly, if we feel as if there's not enough volume to support a complex program such as that, we work with partners such as MUSC to refer those patients to those academic medical centers because they're doing multiple procedures a day. It would be inappropriate for us to say do if we had an open heart program, 3 to 5 open hearts a month. You don't want an open heart
Yeah.
surgeon that does
3 to
5 a
5,
month. You
right.
want an open heart surgeon that does
5 a
10
day.
yeah, 10 a week,
You're
right?
right, exactly.
Because it's not just them, it's the anesthesiologist, it's the team that is with them, it's their physician assistant that is helping to close, it's those that are following up with them in the critical care ICU. All of those sort of factors go into our service line planning. So what we really look at is again population growth, what is leaving the market, what can we do safely in the market, and then we develop those service lines appropriately.
So where are we growing? Where is healthcare? First, I'm going to say, where is healthcare in our low country growing for you all? And then where do you see healthcare in general going, if you will, in the next 3 to 5 years?
Sure. So obviously Beaufort County, Jasper County, two of the fastest growing counties in the state, and healthcare has struggled to keep up with accessibility. And so one of the
With accessibility.
with accessibility,
And that means it's tough to get.
a physician appointment,
Okay.
primary care, tough to get a specialty care appointment.
Got it.
It's not tough necessarily to get into an emergency room, although you are seeing emergency room waits extend.
Mhm. Yes.
More so than we'd like. And so one of the things that we're focused on is really that appropriate growth that focuses on where healthcare is going, which is, to your point, more focused on the outpatient care, more
Okay.
focused on same-day surgery, on
Okay.
overnight stays, and less on that tertiary, I'm going to need to stay in a hospital 5, 6, 7 days. And so as you see Beaufort Memorial grow, you're going to see uh, facilities like Bluffton Community Hospital, which is designed
Bluffton
to
Community.
meet people
Okay.
where they are,
Okay.
designed and tailored to the demographic in which we will serve, which is more surgically inclined, more
Okay.
outpatient surgery, more overnight stays. Think
Okay.
total joints. Think general surgery, GYN surgery. I mean, these sort of things that can be done same day or discharged home the next day.
Is that due to the population?
It's due to a healthier population.
Okay.
We are seeing a healthier population. Actually, Beaufort County, as statistics go, is a healthier population
That
than
doesn't
most
surprise me.
counties in South Carolina.
Mhm.
I mean, we in Beaufort County are very healthy compared to a lot of counties in the state. And so, I mean, we have an active lifestyle. We love to be on the water. We love our tennis. We love our golf. A lot of the gated communities that are being built are built towards the more active lifestyle. And so because of that, you're seeing less and less of this sort of very complex, complicated care and more of, I need a joint replacement.
Got it.
I have tennis elbow. I need elbow surgery.
I just was thinking
Yeah,
that. A
right.
new elbow would be fun.
I need more therapy or
Right.
injections than I
Yeah.
do necessarily this very complex procedural care. And so that's why we're building these smaller facilities within in the backyards of these communities to meet patients where they are, offload ER waiting and boarding
Okay.
times.
Okay.
The Bluffton Community Hospital will have an emergency room,
Mhm.
so offload, I think, some of the long wait times, the other emergency rooms in the area. And then what we are seeing is when we do fill up at Beaufort Memorial, is more and more in that med surge sort of capacity. 1 to 3 day length of stays. We have capacity in our ICU, which is why we don't feel the need to build more ICUs in the area. But we need that med surge capacity, which is why we're building 28 beds here in Bluffton, so we can offload some of that low
Got
acuity
it.
care from Beaufort Memorial, which does fill up a lot of times with people waiting to have rooms open up.
And to that same point, I think it's technology too.
Sure.
So now I had my hip replacement, and I was one of the first ones to go in at 7 in the morning. I was home before 11 o'clock.
Were you
Yes.
really?
Yeah,
Yep.
and in years ago, it wasn't that long years
Mhm.
ago that it was if not days, weeks in the hospital to recover, and I was home in a matter of hours. And essentially, the surgery didn't change. They, sawed it in there and did a lot of mechanical work, but everything else is so much better, and the technology is so much better.
It's so interesting. What about a focus for hospital systems now, especially yours, on prevention and then sort of an overall shift to a more wellness perspective? Is that something that is even in the works these days or important?
Oh, absolutely. I mean, if you look at our network, we talking about healthcare systems. I mean, we have the largest primary care network in the area. We have well over 50 employed primary care
Oh, wow. I didn't
providers,
know that. Okay.
in our multi specialty physician group. They are focused on prevention and wellness, and we are standing up certain new plans such as patient-centered medical home models and accountable care organizations. And all of these organizations and models we're setting up are designed to keep people out of the hospital, and their relationships with payers, Medicare, Blue Cross and Blue Shield, and other payers, that allows for a shared savings model. And what that means is that essentially we are charged to keep people in the lower cost of care sites. If we keep them in the lower cost of care sites, we get to share in the savings with Medicare and the payers that they otherwise did not pay out based on what the actuaries expected to pay out on those medical claims at the end of the year.
Okay, now say that in like
So
two sentences.
I can do
Yeah.
it. I can do this.
Yes.
So
Dave's
so-
going to summarize
that.
for
Yeah,
you.
yeah, no, because
I was like, I got you.
Yeah.
because right, no, this is a really important thing because forever the
Okay.
government and all the insurance companies did not pay for wellness and prevention. They didn't care.
Okay.
You sent them a claim, they send back a check.
Okay.
And this country is spending more money than anybody else and not getting the quality care.
Okay.
So
Because
now
we treated sick people.
correct. So Medicare says, okay, there's 10,000 people that
Got
live
it.
within this group.
Okay.
And we're going to contract with Beaufort Memorial to manage the health care of all those 10,000
Yes.
people. And those 10,000 people should spend $1 million a year in health care,
Yes.
roughly.
Right.
If you do that, and he does a really good job,
And they only
and they
spend
only spend
500,000.
700,000,
Okay.
there's a $300,000
Savings.
Savings.
Ding, ding, ding. Okay.
He gets to get half of that, or whatever the number is,
Yeah.
and the government keeps the other half.
Oh, that's
Everybody
brilliant.
wins because these people are healthier. They're not going to the emergency room. They're diabetic. Their A1C is under control.
Exactly.
They're all on an exercise program. They all have a
Absolutely.
shared gym. They all
love it.
go here. They go here for X-rays. They go here for this and that and the other thing. And we manage people's health care instead of just waiting for them to get sick and come to us.
Wow.
Correct. Nice summary. Yeah. We were going from
No, that's-
I know. I was like,
a fee-for-service sort of
Okay.
model
Right.
to a value-based care sort of model.
Correct.
In
okay.
which we're charged to help manage that population and save everybody money. Saves the patient's money, saves the government money, and ultimately we get to reap the rewards of that savings should we accomplish those goals.
How do we get the buy-in from patients? How do we as patients begin to shift our perspective to one of wellness and prevention?
So that is a good question because
Yeah, you're like-
there's all the great plans that we lay out, but the patients have to engage, right?
Okay.
And that's back to that team health concept, right?
Well,
They
that's
have to be a part
education.
of the team, and they have to when they leave the physician's office,
Got
right?
it.
They have to actually follow through on that diet plan that they were prescribed, right? Go
Look at
Don't
me
get
for.
me.
the medication.
Good at this.
I'm trying to walk.
You use the join the gym.
Yeah.
Right. Beaufort Memorial has Life Fit Gym. We have 4-year degree exercise physiologists. We prescribe with a lot of our patients, a plan with those exercise physiologists. So engage in the post-discharge, post-visit planning, and that's how we kind of work together as a team.
Got it. So
But
what?
the patient has to engage.
Okay, so I'm going to take that one. Basically, what you're saying is you get people into prevention and wellness when they go to the doctor, and they do as they're told.
Yes. Yes.
Okay,
correct.
we have come up with a treatment plan. We agree on the treatment plan. Now it's up to me as the patient to follow that
Follow
treatment
through.
plan.
Correct.
My life. Okay.
Yep.
I mean, it sounds so intuitive.
Well, I think thankfully we live where we live, where a lot of people are already plugged into that. People want to live a healthier life.
Yes.
Smoking has gone way down. I
Has
think
it though?
I think it has.
Really?
Could be
I don't
wrong.
know. I see all these kids with.
Well, it's
But your
vaping,
view
so-
is
Yeah.
your view is
yeah,
skewed.
Yes.
That's
I
right.
see general population.
Okay.
So, but anyways, I think people are trying to exercise more. They're
Yes,
trying to
I
live.
agree with that.
They want to be with their grandchildren. They want to live healthy. They don't want to be 80s and 90s and
Right. We want to
have
be
all
able to
sorts of
play with
issues.
our kids
Correct,
at 90.
correct.
Yeah.
So I think there is buying, and I think it's been a difficult shift. Like I said, this is new. Forever, no one has spent any money on preventive care or health wellness. Wellness wasn't a concept 20
Right.
years ago.
You know what we talked about in a previous interview? We were talking about the differences in hospitals from when you and I grew up in them to now as a much more collaborative team venture as opposed to doctor here, nurse here, dietitian here, pharmacist here, phlebotomist here. Much more collaborative. And that has helped with that team approach, really with quality of care also. Is that something that you agree with, or how do you What do
Oh,
you all
absolutely. I
do?
mean, we call it multidisciplinary teams.
Okay.
And within that multidisciplinary team approach, you bring all of the caregivers to the table.
All right.
And in those meetings, they talk about each patient and how they're going to collaborate and do what's best and right for the patient, not only while in the hospital, but even working with care managers and social workers with that post-discharge planning. And even within that post-discharge planning, back to getting them back to their primary care physician, getting them back into an appointment quickly after discharge to make sure we're following up on those post-discharge instructions. Did you get your medications as prescribed? Are you going to go to your physical therapy visit follow-up? That is also key in making sure back to that sort of value-based purchasing concept, make sure they don't come back to the hospital in an ER or readmitted status. That is key in sort of that multidisciplinary team approach with us.
So, from the head of the leadership of Beaufort Memorial and the hospital that you run, what are you hoping to see? What are you implementing that you are really proud of and are getting buy-in from a cultural point of view, just from the medical point of view?
We've talked a lot about the
Initiatives, I
patient.
guess.
Yeah, we've
Yeah.
talked a lot about the patient, but one of the things that we're really very proud of as an organization is really sort of how we approach investing back into our workforce
Ah,
and really looking at our workforce holistically. And we look at the mental health and wellness perspective of our healthcare workforce, which is important,
absolutely.
especially post-pandemic.
Correct.
Then we look at our financial wellness, and
Got
you've
it.
seen certain initiatives that we've had, such as house buying assistance programs. We have childcare on site. We just broke ground here in Bluffton on our first of what we think will be three attainable workforce housing projects across the county.
Oh,
And then lastly, the educational upward mobility aspect and really investing in their education and their ability to grow within the organization within our PATH program with partnerships with Beaufort County High School and with TCL and University of South Carolina Beaufort and the nursing school we developed with them. So really one of the what I think is one of the best projects
yeah.
we've had over the last few years, and we've had a lot of projects,
Yeah.
is our PATH program and really investing back into our
Tell
workforce.
us a little bit more about that PATH program specifically.
So it was created post-pandemic,
Got
and
it?
it was an acronym for people achieving their highest.
Ah,
And again, really trying to make sure people are, when they enter a role at Beaufort Memorial, how can we make them most successful?
okay. Wow.
And again, first it started with the resiliency and mental wellness,
Yes.
especially coming out of the pandemic. And we
Correct.
really invested in a lot of programming, apps on your phone, and even employees to really deal with things that were coming out of the pandemic and
Got it.
burnout. And then, as you guys probably have discussed at some point on this podcast, the cost of living in Beaufort County is
Sure.
extremely high,
Yes.
second highest in the state if you look at the statistics. And so we really tried to, what is the root of that unaffordability within the county? And there were two things that really stand out:
Housing.
housing and childcare.
Yeah.
And so we have really set out to be a leader in those two areas where we built childcare on the campus in Beaufort. We plan on building a second location in Bluffton as the new hospital comes up, but also working on that affordable housing, attainable housing piece. And with the collaboration of Beaufort County, the town of Bluffton, and a partner of ours, Wood Cooper Companies, which specializes in attainable housing, we broke ground on Livewell Terrace, but we have two other projects we're working on them because at some point the calculus doesn't work. The cost of living can't keep increasing
Right.
at the rate that it is increasing.
Right.
And on the flip side, healthcare is not keeping up on the reimbursement side.
Got it.
And so at some point we kind of have to find a way to slow down the hyperinflation in this county. And you can only do that by housing and childcare. And then lastly, that PATH program, we've graduated well over about 120 people now from within our workforce. And what that has done is it gave them ability to remain gainfully employed at Beaufort Memorial, go back to school, work part-time. We
That's
actually pay
amazing.
them full-time wages because really, we wanted to remove barriers from them becoming something different or doing something better within the organization. But most people's barriers were, I have a family,
Right.
I have
I
bills,
can't go back to school.
I can't
Yeah.
go back to school, I can't afford to work part-time. So we had to find a way to remove those barriers for our employees who we said, hey, you're one of the best and the brightest. We want you to move up in the organization. So let us help you do that. And by creating this path, we've allowed them to become patient care techs, endoscopy techs, certified medical assistants, really helping them. I mean, we've increased their wages by $5 to $6 an hour on average by moving them up in the organization from one role to the next. But it really solved a problem for us because it filled where we had a lot of gaps and really that allied health sort of opportunity, right? Who are helping the nurses and the physicians. And then lastly, with University of South Carolina, Beaufort, we built a nursing school on site with them. And what we wanted to accomplish is allowing USCB to expand their program, not from one cohort per year, but two. So now instead of accepting 24 nursing students per year, they're
48.
accepting 48 per year. And what that does, hopefully, is helps address the nursing shortage in this county. As this county grows, we're going to need more nurses. The only way to have more nurses is to train more nurses.
Correct.
Right.
Isn't nurse practitioner like the #1 career to have moving forward in the future? It's so interesting.
It is, and it's one of the fastest growing. But what that does is addresses one, maybe an accessibility issue, especially for primary care. As you see more
Oh,
primary
I
care
see.
shifting towards nurse practitioners and
Yep.
physician assistants. But a second, kind of a problem it creates is it takes those nurses away from the bedside.
Got
Correct.
it.
Right.
See, that's
They
so
move up. You got to
yeah.
get people to fill in, backfill,
Correct.
or you just kick the can down the road.
See, this is why I love doing this because it's so interesting just from a different perspective point of view. All right, one last question.
Yes.
Do you have a prescription or a habit that you have adopted for our Mind Your Health viewers that is really important to you or really works for you that you practice?
Is it a personal habit or a habit at work? Or either
Yes,
or?
we love
Both.
either
Either
or.
or,
Yes,
both.
we're very broad spectrum here.
Yeah.
We let you
Okay.
choose.
All right. Well, I'll go more on a personal nature. So, I developed very early on that waking up early and more to the health and wellness, getting a workout in every morning
Okay.
before everyone else is up. And it does two things for me. It really helps me clear my mind and get my head straight for the day to come and lets me focus on what I want to accomplish. But it also allows me to take care of myself, which is important. You have to first take care of
Self-care.
yourself, right, before you can take care of everybody else. It's kind of like when you're on a plane, they teach you to put your mask on first before you help you have to do the same thing with your mental health and wellness and your physical health and wellness. You have to take care of yourself, or else you can't take care of other people. And so really developing a habit of a 4:30 to 5 a.m. wake up call, going to the gym, getting that out of the way, and really getting my head straight and focused for the day is a habit that I developed very early that's served me well.
Well, Russell Baxley, thank you so much for joining us
Well,
here
thanks.
on
Mind Your Health.
Mind Your Health.
And thank you guys for having me.
Bye-bye.
Mind your health.